want to get Dr. Jamie Taweel's 2 cents on this topic. He's an internal medicine specialist with the Grand River Medical Associates and kind of our doctor resident here on the Oakland County MegaCast. Dr. Taweel, thanks for being with us.
Oh, thank you for having me, as always. How you guys been?
We're good. We're good. Just getting a little stressed, realizing Christmas is around the corner. 72 days.
Yeah.
It comes on quick, and it's like, oh my gosh.
I have all this shopping I didn't even realize I had to do. Oh my God.
Oh no.
Amazon Prime. Jump on it. Hey, so Doc, I'm sure you've heard about the concerns about the second wave possibly hitting the state of Michigan. What do you think? Are we in for a long haul here?
I think we are. Well, I don't think we're in for a really long haul. I think hopefully we'll have a vaccine coming soon, and that can help us get a little bit better situated. I think we are due for another bump. I mean, the weather's getting colder. People aren't doing a lot of outside social distancing. They'll start to coalesce and get indoors. And when that happens, they're going to be exposing each other if they're not going to be able to social distance. Restaurants are open again. People are starting to get back in there. There's, still some, the gyms are open. There's just a lot of people are going to start mingling a little bit more. And as the holidays hit, people are going to do a lot more family things. And I'm expecting a bump to occur. And I think it's going to with the improved, the more lax guidelines that we're all following, which, we're still doing social distancing. And I don't want to keep rambling about all of that, but I am concerned it's going to bump a little bit.
It's not surprising to me. You would almost anticipate that this is going to happen. And even more so, more and more people are being tested as well. So there are probably how many people walking around who had COVID that were asymptomatic that you didn't know about. So now with contact tracing, more people are being tested, so you're going to get more positive results.
Absolutely. You're going to get some more positive results as a result of increased testing. And then you're going to get more positive results because people are out now doing more. Schools are starting to open up again. It's just, all around, we were going to expect a bump to occur. The hope is that it's not overwhelming. And hopefully it won't be. I think we're going to do I think Michigan still does really well, all things considered.
The hope is a vaccine will be here sooner rather than later. However, the news coming out the last couple of days, some of the trials have been put on hold because of an illness, unexplained illness in one of the test patients. However, they're saying that's not unusual for some of these trials. It's just now because it's COVID and so much attention is put on COVID, we're understanding this process of what it takes to actually get a vaccine to market.
Yeah. These are the things. This is the reason why it takes so long. They're always, you want to find these things in the trial period. You want to make sure that these things are going to be addressed and handled and avoided in the future. I don't know the exact details with regards to the illness that people were getting. I don't know if it was a result of the vaccine or if it was a unexpected illness that occurred. It did happen in 2 of the trials. I know from what I understand, 2 other trials are still ongoing, and they're entering different phases. So this is promising, but it's going to take a little bit of time, and that's, and for all intents and purposes, it should. You never want to rush a vaccine that's going to be dangerous. We're already in a scenario where people are having a lot of skepticism with regards to things. And I think introducing more of that would be a bad idea. So I think the slow precautionary approaches that we're taking are appropriate. I hope they can move faster, but at the same time, you never want to sacrifice quality for speed.
So I saw a study too. They were talking about kids and obesity right now and during the pandemic, because kids are not getting up and getting outside and moving around as much as they used to. But it's still, it's not like when we were kids and your parents were like, go outside and play, don't come back until it's dark outside. Now more and more kids are not only doing remote learning where they're sitting in front of a computer all day, but they're also on their devices playing computer games instead of out playing kickball. And there's a concern now about childhood obesity. What are you seeing in some of your patients?
Well, I'm not a pediatrician, so I don't have a lot of children that I can bounce off the childhood obesity. I will, however, say, with regards to a good majority of patients that I deal with, we've all gained the COVID-15, myself included. I'm guilty of that as well. People have been gaining weight throughout this period of time. One thing I often remind my patients, though, is yes, I understand that things are limited in terms of activity, and I've been hearing that nonstop. Oh, due to the quarantine, I've basically been indoors. I haven't moved around as much. I haven't been able to work out, and as a result, I've gained a lot of weight. My usual response is that the good majority of the weight you lose is going to be in the kitchen rather than the gym. Nothing's going to be better than an adequate, appropriate diet. That's going to be, you're going to lose a lot of weight with how you eat rather than what you do. Now, don't take that as me downplaying the importance of physical activity. Sedentary lifestyle has been linked to multiple diseases, heart attacks, things to that effect. So I do, activity is crucial, but in terms of obesity, nutrition is going to be a equal, if not bigger part of that whole cycle. And if you can get your diet right, I think a lot of that can be avoided.
Yeah, but people are home now. They're home so much more, whereas before maybe you were in the office, you didn't have access to the refrigerator 24/7, so it's easy to get up, go grab a cookie, maybe a cracker or a piece of cheese, and you forget how much all of that adds up in a day.
Absolutely. I'm kind of noticing a trend here when it comes to patients. I have two types of patients: those that are taking advantage of this quarantine and saying, we're now cooking our own meals, we're being very conscious of what we're eating, things to that effect. And then there's the other ones that are like, yeah, I'm home and I'm I work 12 feet away from a refrigerator, and people are drinking their calories, they're doing a lot. It's tough, and I want ideal situation would be for my patients to find a balance where, yes, you are conscious of what you're eating and you're able to make your own meals and do a little bit more prep work and be more aware of what you're putting into your body. But at the same time, I want you to be able to live your life and do some of the things that you want to be able to do. I always felt that, a fad diet in and of itself, or anyone that's just really, really strict on their diet, usually sets themselves up for a letdown, because that's not a lifestyle. I want people to be very, I want them to have an appropriate lifestyle that's going to be beneficial and at the same time allow them to live a little bit.
My sister keeps harping on us, take your vitamin D, take your vitamins, do this, do that, because part of COVID is it's attacking people with underlying conditions. And so the healthier you are, the less chance you're going to get COVID, or at least it's not going to be so serious if you do get it. So are some of the patients aware of that? Are they changing their lifestyles because of it?
I think at first I saw a little bit more of that. I think a lot of people more or less were just concerned that they were considered a high risk patient because they had, different people were really concerned that they were high risk because they had comorbidities. However, I haven't seen a lot of people that were like, all right, I need to really get aggressive on my blood pressure because I want to make sure that I'm not, I'm managing that as best as possible. Patients are motivated to do well. I've never had more people motivated to get flu vaccines and things like that than they are now, thankfully. But at the same time, I don't really, I haven't really seen a lot of people that were like, all right, I really need to get my sugars under control more than they already have been, because they're concerned that the diabetes would, I think more or less they took it as I'm high risk, and they kind of just accepted it as that. And I think it's up to us to make sure that we are aware that the better you control those things, the better your risks are. You want to go into any fight that you're going to have with the most, the best advantage you could possibly muster up. So of course, if you do have issues with blood pressure, obesity, vitamin deficiencies, diabetes, you want to control that as best as possible so that you have the best outcomes should you be unfortunately hit with this disease.
Dr. Jamie Taweel with us, internal medicine specialist at Grand River Medical Associates, with us today on the MegaCast. Dr. Taweel, you touched just briefly on getting your flu shot and on the flu season. With what we're seeing with COVID-19 right now, where it is spiking in some places throughout the country, including the beginnings of what looks like a spike here in the state of Michigan as well, with the restrictions being lifted by the Supreme Court and new regulations slowly but surely coming into place. How much more important now than ever before is it for people to be safe in regards to the flu and to get their flu shot?
So I am a physician. Every patient sits down and looks me in the eye and goes, all right, between you and me, should I get a flu shot this year? And my answer is always the same. Like, I'm a doctor. It's my job. I'm always going to recommend a flu shot. I'm always going to recommend a flu vaccine. That's what I believe in. A flu vaccine will reduce your risk of flu. Will it make it zero? Absolutely not. But at the same time, it will improve your risk of contracting the flu. And if you do contract it, hopefully will reduce your risk of having it be dangerous. I do think that the social distancing, the masks will actually lower flu rates this year. And I hope that they can correlate that as opposed to people that just did flu vaccines and see exactly what the benefit was. I'm looking forward to seeing that data come next year. I do recommend the flu vaccine because I think that the one thing you do not want is to catch the flu and COVID. I think if you get both of those, that's a 1-2 punch that's not going to be very well tolerated in a huge population of the country. So I again, like I said earlier, any battle you go into, you want the biggest advantage possible, and even unwilling battles such as infections. So I think it's going to be a great idea, and I'm always going to recommend it.
So fall time seasons are changing, and with that, allergies. Excuse me. So I have the pleasure of having fall allergies, and I was out over the weekend trying to take advantage of this beautiful weather before it goes away. And then, of course, your head fills up, you're congested, your nose is running, and everyone is looking at you like you have cooties. And you want to say, no, it's not COVID cooties. It really is just allergies. And, of course, I took an Allegra, and it clears up for a little bit. Then you go back outside, and it's a cycle again.
Oh, yeah.
How do you know the difference between the two?
I think most importantly, you're going to deal with COVID if you're people that have allergies know their allergies. People that call me up and say, look, this is my allergies. Can you please just give me my medicine? They know what's going to work and they know what they're feeling. People always know when it's their allergies. I have people that come in and they cough and they go, no, it's just my allergies, I swear. And I believe them.
See, I'm not the only one. Everyone looks at you. I'm like, no, I don't have COVID cooties.
Plus, like you said, you take an Allegra, it does get better. COVID's not going to do that. And also, the big thing is if you're going to have a fever, anything that you're experiencing that isn't typical for allergies. Now, let's bear in mind, allergies, poorly controlled allergies do lead to sinus infections and certain types of illnesses that can occur. Excuse me. But you usually, again, that. And certain things like a sinus infection, it's all going to be in the sinuses. You're going to feel that. You're going to know what it feels like. It's in one spot. It's not a head to toe thing. COVID is a little bit more like you kind of felt like you got hit by a bus, sore throat, difficulty breathing, sometimes stomach upset, fevers. If you get a spike in fever, that's always going to be something you need to be concerned about that may be COVID related. So whenever you start hitting fevers, double check and make sure, call your doctor and make sure that they're aware of what's going on and they can direct you in the right they can direct you into the right place to see what needs to be done next.
Is there anything people could be doing to try to boost their immune system going into the winter months?
Yeah, a well-balanced diet, make sure that they're addressing all of the, issues with regards to their health. If you're a diabetic, getting your sugars under really good control will definitely improve your immune system. Things to that effect, just doing the best that you can on your end. Medicine is a two-way street. I can write medications all day, but unless you take them, pay mindful attention to your diet, mindful attention to your activity levels, mindful attention to who you are interacting with and whether or not you're putting yourself in, precarious situations, i.e., giant gatherings of people without a mask. It is Halloween. People are going to the cider mill and things like that, and they're gathering. So just make sure that you're doing a lot of things to protect yourself as best as possible. That's the only thing I can ask for in my patients.
Vitamin C, does that work? Zinc, vitamin C, should you be taking extra supplements right now?
They do work to a degree. I don't think that they're going to be the end-all be-all magic bullet. Taking extra supplements is never going to be a humongous issue as long as you're not taking massive doses. Vitamin C is an excellent supplement. Definitely recommend that they take it. I think whatever you would take in a daily multivitamin will have adequate amounts of everything that you need, and that's pretty much all you should need. Nothing beats a well-balanced diet more than anything else, truth be told, but definitely adding some supplements are always going to be recommended and certainly will not do harm.
Dr. Jamie Taweel with us on the Oakland County Megacast, joining us today, talking about the latest in medical information about COVID-19 and, of course, the flu season, both heavily in the news at this moment in time. Dr. Taweel, in the recent weeks, with the president being hospitalized and with upticks in COVID-19, we've heard a lot about a variety of different medicines, including the antiviral cocktail that the president was given at Walter Reed Medical Center, and remdesivir, who have both come back into play, into the news once again. Can you talk a little bit about some of these different treatment aspects that are being put into place, what you maybe know about them and why they're being used, and if they would be widely effective, or is it more of a patient-to-patient basis?
Okay, that's a lot to unpack here. I'm actually amazed, for all the touting of hydroxychloroquine, how come that wasn't included into his cocktail? But that's because the FDA decided and deemed it to not be effective, so he did not receive it. So the things that he received the remdesivir, which is an antiviral, which early studies had shown that it had been beneficial. He had also received high doses of dexamethasone, which is a steroid, also shown to be beneficial to patients that were in severe cases. He had also received the monoclonal antibody Regeneron, I believe it was called, which is a experimental drug that was deemed to have compassionate use. So it kind of bypassed a lot of FDA studies. So with regards to the Regeneron, I mean, literally I have a case of one, and he was also receiving multiple treatments at the same time. It is extremely hard to say whether or not that monoclonal antibody was the magic bullet that made him so much better. We also don't have a clear idea of how ill he was. Those medications that he received are typically reserved for patients that are very ill. I get a lot of outpatient cases of COVID that come through, or at least I interact with through my office, and I'm not writing for dexamethasone. I'm not writing for, remdesivir, because those are reserved for patients that are, essentially severely lung compromised on a ventilator. So he kind of got a massive dose of multiple medications that were for really sick people. From what I gathered of what I've been told, that he wasn't as ill as we had thought. I mean, he required supplemental oxygen on 2 random occasions. From what the official statements were, it seemed like it was a little bit of overkill, if anything else. But at the same time, he improved, and it's hard to tell which of those things improved him, or whether or not they were just being precautionary because he's the most powerful man in the United States, so they wanted to just make sure and threw the kitchen sink at him, and maybe he didn't even need any of it. It's hard to tell. So, the medications that he did receive did work. Again, I can't speak on Regeneron because there's no clinical trials that, to my knowledge, that were suggestive that it's going to be of benefit. Of course, monoclonal antibodies in theory work very well, but he also, again, received steroids and remdesivir, which have been shown to already improve outcomes. So it's kind of hard to have a head-to-head on something like that.
And once something like that makes the headlines, do you start getting a lot of calls and have to have these conversations with patients because they're saying, well, it worked for the president, so it's got to work for me, and is it available for me?
So I have not received anything suspicious. Like, no one's called me and asked for, remdesivir, because patients that are ill to that degree are getting it based on guidelines, that are getting it in the hospital. The cases that I interact with, fortunately, are the outpatient. I feel a little bit miserable. I deal with primarily mild cases. I'm not seeing those that are on a ventilator, those that are really grossly ill. Thankfully, I have had a lot of patients ask me for, azithromycin, when at first there was a rumor going around that azithromycin was going to reduce your risks of, COVID severity. I also was getting a lot of calls with regards to hydroxychloroquine, which has blown over. I have not really gotten a lot of calls based on, remdesivir, dexamethasone, or, Regeneron. So thankfully. But I would explain to my patients that those are for severe cases. And if you're calling me asking me for them, then typically you're not going to require it.
Right, because you wouldn't be able to ask for it if you were that severe. And for the mild case,
made for you rather than you're asking for it, if that makes any sense.
Yes, yeah. And for the cases that are still the mild cases, is it still what was being recommended in the beginning, basically stay home, isolate, and get a lot of fluids?
Pretty much. Symptom management. So if you're having significant nausea, we'll treat that. If you're having difficulty in breathing, we'll treat that. But we're dealing with symptoms, not the problem. We're waiting for the problem itself to just go away. Your body is inflammatory, and we're trying to blunt that as best as possible, while at the same time allowing it to address the issue. But for the most part, a lot of it is just stay home, hydrate, don't get anybody else sick. If things get worse, then go to the hospital, where then those decisions might need to be made for you.
Dr. Jamie Taweel with us, internal medicine specialist at Grand River Medical Associates, with us on the MegaCast. Dr. Taweel, just another couple of minutes before we got to let you go. Anything else that's important for our audience to know at this time, or that they should be aware of regarding COVID-19 or other medical information?
I think the public has been pretty well versed in a lot of this, and I'm very glad to see that they're doing the right thing a lot of times. You know, things have been lax. I'm still seeing a ton of masks out there. Everybody's wearing them, thank the Lord. I think Michigan has never failed to impress me with their willingness to do a lot of important things. So I encourage them to continue it. I do caution, though, flu season's coming. Get your flu shots. Make sure you're getting all of your health under the best possible control. Make sure your diet is very appropriate. And just be cautious as things start. You know, we're going to come into Halloween. We're coming into Thanksgiving. People are going to start gathering and they're going to start getting indoors. Please do your best to just try your hardest to maintain some social distancing, wear the masks, and just be cognizant of the fact that that random stranger next to you could have something that could make your life not well. So just you know, don't be paranoid by any means, but at the same time, be cautious. And that's what I would ask of anybody that's out there in the world.
Doc, always great having you on the show. We appreciate your time. Stay safe, stay healthy, and Halloween's around the corner. If you're going to celebrate, I hope you, if you have kids, have a good time. Safe Halloween.
But I will celebrate because I love Halloween.
It's my favorite holiday, too. I've already put up all my decorations.
Always been my favorite holiday.
Well, thank you so much. I'm sorry?
I said, you guys be well. Thank you so much.
We will. Hey, are you going to dress up for Halloween?
Not this year. I don't think so. I usually try something, but this year Halloween's on a weekend, so I don't really have an outfit to wear to work. So.
Yeah, that's true. You can wear it through your house. That's
Let's
okay.
go for a walk in it.
Dr. Taweel with us on the Oakland County MegaCast. Always great having you on.